It seems I have quite a new follower, so I want to take a moment to answer this question. I was born with female reproductive organs, so what that means is when the doctor saw me, they said, hey, this is a girl. When my parents saw me, they said, hey, this is a girl. And when society saw me, they said, hey, this is a girl. But when I really, truly stopped and started to see myself, I said, hey, I don't feel like a girl. I feel more like a boy than a girl, so I transitioned genders, but I knew that I always wanted to carry my own child. Just because I didn't feel like a woman or a girl doesn't mean that I can't take advantage of the body organs that I was born with, so I decided to wait to carry Wilder until I transitioned genders, so that I could feel at home in my body, so that my baby too could feel at home in my body. I'm Wilder's dad. I'm Wilder's papa. I'm not Wilder's mama, but I was given the gift of being able to carry my child, and so I did. That's how I'm a dad.
Hey, so hope you guys had a really good Christmas. It just had, anybody who's on break is just having a nice relaxing break. Hopefully you guys had time to spend with your families. And I wanted to, so this video we're going to take a look at issues affecting trans-identified females during pregnancy and childbirth.
Tips for transmasculine folk who are considering pregnancy, aka seahorse dads. Pregnancy isn't for everyone. Not all AFAB trans people want to birth children. Everyone's journey is different. I'm on a waiting list for testosterone and I wanted a biological kid before I started T. It was convenient and I was financially stable and felt that I was mentally fit to do so. In regards to dysphoria, your baby is your world. There's no room to stress yourself out. As hard as it is, every time those dysphoric thoughts occur, you have to cope and know that your child will be worth the pain and struggle. Coping with dysphoria during these times are tricky because if you haven't had top surgery yet and intend to not use formula, you cannot bind throughout the entire thing. It can cause issues with your chest and can decrease milk production. I have more of these tips and tricks up my sleeve for transmasculine folk who are curious about pregnancy. If you want to know more, let me know.
My mom know I'm a demon, it ain't nothing she could do but pray for me.
And we're going to take a look at a condition known as Poly-Cystic Ovarian Syndrome, or PCOS. It is a very common metabolic disorder in women, and that we know has pronounced impacts and effects on pregnancy, fertility, maternal-fetal morbidity, and even birth complications and congenital defects and other related issues, obstetrical issues. So we'll try to see what sort of inferences we can make about PCOS, because one of the biggest complicating factors of PCOS is the free bioavailability of high levels of androgen testosterone in female systems, and how this, endocrinologically can disrupt the other of hormones in a female's body. They're necessary for developing healthy eggs and for conception and for carrying a child to term and having a healthy pregnancy through all 3 trimesters of pregnancy and all 3 phases of childbirth and the postpartum time. The whole perinatal period is affected. And I think that there is a lot of inferences that we can make about women who use exogenous testosterone to achieve some sort of cosmetic effect. So, yeah.
Can we skip to the good part?
And there's, as we know, there's intergenerational complications that happen with women who have too much androgens in their system and testosterone. So, yeah, we're just going to take a look at what we can figure out looking at PCOS and trans-identified females and what sort of hypotheses we might be able to sketch. And also just take a look at the sort of social aspect of motherhood. Are these women who identify as trans, are they able to transition into the father role?
Who cares? No big deal. I want more. wanna see them dancing, walking around on those, what do you call them? Oh. Flipping your feet, you don't get too far. Legs are required, jumping, dancing, strolling along down the, what's that word again? Street.
Or, you know, what is most commonly, you know, the social role of being a dad? I'm sure you probably guessed the answer is no, because again, from a biological and a sociological perspective, these women are still very much taking on the role of mothers, and they're even ending up single mothers at the same rate that non-trans identifying women are. And dealing with the same exact issues. And are we preparing them for that? Are we giving them, you know, sex-based education, and also raising the concerns about what if we stop offering real sex-based education? You know, we're gonna really put these women at a disadvantage. What are we gonna give them, like male sex education? You know, all the lives that are impacted through this, it cascades. It's important. So yeah, so we're going to take a look at trans men today, or trans identified females. And yeah, let's get into it. So to reason that there's something called Poly-Cystic Ovarian Syndrome, or PCOS, or PCOS, and it is an endocrine disorder. Women who have PCOS tend to have fertility problems and high production of androgens. So everybody produces a certain level of androgen hormones, meaning the opposite sex hormones. So if you're a female, all females make testosterone, low levels of testosterone. Women with PCOS have very elevated levels of testosterone. That's why there are a lot of women who are not on exogenous hormones or hormone replacement who grow facial hair. And it is a fairly common symptom of severe PCOS. So I know that women with severe PCOS have fertility issues, high rates of miscarriage, and it is one of the most common endocrine disorders because it is about the balance of androgens within a female endocrinology system and how it impacts fertility. It's interesting to look at what we know about PCOS, polycystic ovarian syndrome, and what we can apply that to make broader estimations and develop hypotheses for how externalized testosterone might be impacting women of a childbearing age. And again, if these are women who are not receiving accurate sex-based education, they might not be understanding their fertility, how pregnancy really happens.
So I haven't posted about this yet because I wanted to wait for the ultrasound, but I'm pregnant. I've been out as trans for 2 years. That hasn't changed. About a year ago, my mom told me that she kind of hoped that pregnancy would change my mind.
There are clearly multiple layers of very mentally unstable and unfit people in this home. And clearly there's reason why this painfully young woman who I'm almost sure is a teenager, is now pregnant, looks like she's unpartnered, clearly lives with her mother, and the mother is saying that she she hopes that when she gets talking about when she gets pregnant, why are you even talking about this to your like teenage daughter? You're putting in her head about maybe pregnancy will help cure you. Oh, Jesus fucking Christ, I can't.
This morning, she sat me down and had a conversation with me about how it hurt her that I kept calling myself a dad. She pretty much told me that I needed to stop until after I've given birth, because until then, I was like, no, that's not how this works.
The level of narcissism is so real. It's crazy. I always think back to like episodes of like Intervention, and even in just like real interventions, not just the dramatized ones on that show, but with a drug or a drug addict or an alcoholic, and you know everybody has to sit around and you know confront the addict and the alcoholic and let them know how much their disease is hurting them. You know, and that, I mean, that's a really powerful way to sort of confront somebody with a problem and say, we love you, we want you to get help. You don't exist in a vacuum. You are part of a tapestry, you're part of a family, part of a community, and what you do and your illness is harming all of us. And this is what the one context where like that is just beyond the pale. The narcissism in this movement is stunning.
She said I needed to think about her and how it makes her uncomfortable. And I brought up the fact that I do nothing but make sure the people around me are okay and comfortable. And she tried to say, no, you don't.
All right, let's take a vote. Who do we think is telling the truth? This young girl or the mom? Let me know in the comments.
I was like, yes, I do. And she's like, how? So I brought up how I didn't correct her when she called me her daughter. And how I don't correct her when she uses she, her pronouns for me. Because I know how uncomfortable she is with the whole thing. She brought up the fact that it makes her feel like who I was before is dead. And so I threw back at her how she had already told me that I killed her daughter. Almost 2 years ago now. Even my boyfriend can support me on this. And he got me pregnant.
You know, the window of fertility, the way that their cycle is. I mean, if they're, you know, if they've been on testosterone for a long time, but they are still cycling, do they understand? Is that, you know, do they understand what times they're fertile, how to combat their fertility? I'm sorry, not combat it, control it. So, you know, we know that pregnancy complications with women with PCOS, we do know that, you know, there's a high incidence of comorbidity, that PCOS increases the comorbidity of preeclampsia and gestational diabetes, which are two of the most serious common pregnancy complications. For us as home birth midwives, and when I was working in the home birth midwifery, if we had somebody with preeclampsia, that's an automatic referral out. You can't have a home birth, period. Okay, because there is a high chance that you and your baby will be severely compromised due to just dangerously high blood pressure. You know, you could bleed out, pass out, lose consciousness. The baby's, heart rate will usually become, hypercardia and then plummet. We're not no competent home birth midwife on the planet is going to take somebody with hypertension or somebody with severe preeclampsia. And it's, it's awful. And I've had women who ended up having stillbirths because of preeclampsia, and not because they tried to deliver at home, but even just following through their birth, even women who did deliver in the hospital. So, it's interesting to know that there are a lot of complications with women who have naturally occurring higher levels of androgens in their system. And it's really interesting to look at, what could women who are taking exogenous testosterone, who maybe are getting pregnant, not knowing that they're pregnant, or maybe, they have such high levels of gender dysphoria or just body dysmorphia that they don't want to admit that they're pregnant. Okay, they don't know how to ask for help. And they're not listed as a female. They're not getting proper gynecologic care. They're not being examined. This is why just letting people, decide their own health care, that doesn't work.
If God sends me to hell, I will simply not go. What will he do? Send me to hell? I'm already not going. The fuck?
So, and what we know as birth workers is that every intervention conducted during a birth, during a labor process, has a cascading effect. Okay, so even something that is seemingly benign as an AROM, an artificial rupture of the membranes, using an amniotic hook used to hook and tear the amniotic sac that encapsulates the fetus. What then happens is that the baby's head immediately engages and forcefully engages into the pelvis and into the pelvic outlet. And what can happen is, where prior there was an amniotic cushioning between the head and the pelvic outlet and the pelvic bones, now the baby's head is compressed. Well, what if the umbilical cord and the umbilicus was wrapped over the head? Well, now that cord's being compressed, and now we've got a birth emergency. Okay, or even just the fact that once you've have an artificial rupture of the membranes, now there is an increased risk of infection. And a lot of hospitals will now put you on a 24-hour clock that you need to deliver within that clock. And what we know, a lot of primiparous women, first-time moms, their bodies have never been through a labor before. It needs time. Sometimes labors will start and stop. Bodies will warm up. I know for me, my labors are in a slow progress, over weeks, days, and then all of a sudden, things will happen very quickly. But, somebody who's maybe more sensitive to changes in their bodies or more nervous about it might run in, and saying that, they're contracting. Sometimes the cervix will dilate, a couple inches and then stay that way. And if we have a practitioner who doesn't understand this or is just overly eager, can go and just say, well, let's just try to get things started. Okay, that's the fastest way to end up in the OR. And then it's, oh, well, thank God we were in the hospital. We saved your baby. No, you shouldn't have been fucking with it in the first place. And listen, this is never to say that there is no space or no purpose to go into the hospital. As I've already said, we'll risk out somebody with preeclampsia very quickly. Preeclampsia, that if we can't get it under control, if we can't get your blood pressure under control, I'm sorry, but no, you need to go to a hospital. They need to be prepared. You might even have to be induced or have a C-section. So what we also know is that the risk of congenital fetal defects goes up by a lot. So let's take a look at some of the numbers. They're the authors of a study, an authors of a study called Generational Health Impact of PCOS on Women and Their Children. The Journal of Medical Sciences is published March of 2019. So it talks about... the authors of the study documented that women with hyperandrogenism prior to the pregnancy were at a greater risk of preeclampsia and preterm delivery and had a greater serum insulin and serum testosterone were predictive of adverse pregnancy outcomes. So meaning that women who had more testosterone in their system prior to pregnancy had an increased risk of adverse pregnancy and fetal outcomes. Okay, so we haven't even begun to quantify the cost, the human cost, not only in dollars, but just in human suffering that these, exogenous drugs are going to have, not on our generation, but on the next, generations. And if we're going to and again, and talking about pregnancy, okay, pregnancy is such a perfectly, very delicately orchestrated phenomenon that is developed over, millions of years. And the hormones of pregnancy are so delicate, and they're in orchestra with each other, and they're very important. And once you disrupt one, you disrupt them all. Okay, so oxytocin, which is the sort of love and bonding hormone, is what also initiates uterine contractions. Okay, and uterine contractions will often, are painful. Pain serves a purpose. You have to move with pain. When we give women painkillers and they can't feel that, often they can't move with their baby and move with their body, and a baby can end up getting stuck, because we know human heads have evolved to be larger than the pelvic outlet.
And because we've evolved to have bigger heads to accommodate our larger brains, and that we have an incompatibility with maternal pelvic outlet, that's why, women have larger and more open pelvic outlets than male pelvises do. That's one way to identify a female pelvis and a female skeleton from a male one. Okay, it's really important that a woman can feel the pain of pregnancy and of childbirth, because that way she is able to be active. She can move. Things that when you move and you feel a relief from the pain, that means that it's helpful. It's your body is able to tell. If you're in pain, the baby is getting stuck, or it's pressing down too much on a part of your pelvis that is rife with pain receptors, with nerve endings. Okay, but moving it will create relief, and it because you're releasing the tension or the pressure of the baby's head on that part of the pelvis, and it means that you're helping corkscrew the baby down. The baby has to go through a rotation. This is also why they have plates in their heads that have infused, so that babies' heads can mold down through the pelvic outlet and twist and come out. Okay, and if a mother can't move with the pain, if something is disruptive where she can't feel the pain, she can't move with it, a baby can sometimes get stuck, and that'll cascade into a series of problems that very often can lead to an OR or other things. We also know that, so say that, say we decide to augment the labor by trying to jumpstart a labor that, somebody's decided is going too long, is going past 40 weeks, and they start with Pitocin. And Pitocin will create abnormally strong uterine contractions. Okay, and we also know that synthetic Pitocin will oversaturate the oxytocin receptor, so that natural oxytocin cannot be experienced, and it is also not, titrated to the appropriate amount, and it doesn't have the same bonding effect. We know that women who have had augmented labors can have higher risks of postpartum depression and even postpartum psychosis. So, you wonder how these things, going to be impacted by all this free floating testosterone in trans-identified female systems. It says a further study, hyperinsulinemia was commonly present in women with PCOS and is more prevalent when hyperandrogenic features predominate, meaning when there is a lot of testosterone, androgens in a woman's system. The hormones of the opposite sex, usually male-associated hormones, which we all have a little bit of. But when you have a lot, it can cause problems, especially when you're thinking, obstetrically. With pregnancy and labor is exacerbated by obesity and is significantly increased when a woman with PCOS conceives. Insulin promotes a prothrombic and profibrotic environment and potentiates its vascular vasoconstriction, which ultimately leads to an increase in blood pressure. This environment, high blood pressure, is so dangerous to a developing fetus, and it's very dangerous for a mother too. It can lead to an abruption. It can lead to the the placenta detaching from the uterine wall, which is that is a crisis. That is a birth emergency. Okay, because if the baby is not able to get oxygen and blood is not able to come through the placenta during the labor, the baby is going to become hypoxic very quickly. Okay, very quickly. And you know, their heart rate is going to skyrocket, blood pressure is going to skyrocket, and now you're in an emergency. And you need to get to the OR quick. And if a baby is been hypoxic for any amount of time, or even limited oxygenation, and you know, diminished blood oxygen, I mean, you might not even see the impacts of that on brain development until much later. Okay, but we know being deprived of oxygen prenatally creates severe brain damage. Severe. They can cause lifelong consequences for this baby. Okay, and all this could be avoided. Why? So that people can grow a beard? So that people can grow a mustache? Draw the shit on. Fucking get a Sharpie. But no, the human cost is too high. Another thing that is true with women with PCOS is that the impaired glucostasis that occurs for some women with PCOS may lead to intergenerational influence that may not be immediately detectable during pregnancy, hence going undetected, which can lead to an increased risk of congenital malformations and increased cardiometabolic risk for the offspring. Okay, so you know, babies it can because of an increase in influx of androgens in the prenatal environment has an impact on circulatory systems, on the development of the heart, you know, can potentially lead to hypoxia, brain damage. I mean, these are not small consequences. Again, and pregnancy is a very, very precise, orchestrated event that is to be left alone unless absolutely necessary. And listen, interventions are crucial. And you know, you have on one end of the spectrum, you have a lack of access to interventions, and women and children suffer. And on the other hand, you have an overuse of intervention, and women and children suffer. Okay, so you know there should be a goal of keeping interventionalism, you know, in less than 10% of pregnancy, 10% of labors and births. And you know, we're going to see an increased need if people are just playing around with exogenous hormones.
29th, 2020, and this is my voice pre-T. Today is November 2nd, 2020, and this is my voice 1 day on T.
Today is December 2nd, 2020, this is my voice 1 month on T.
Today is January 2nd, 2021, and this is my voice 2 months on T.
Today is February 2nd, 2021. This is my voice 3 months on testosterone.
Today is March 2nd, 2021, and this is my voice 4 months on T.
Today is April 2nd, 2021, and this is my voice 5 months on T.
Today is May 2nd, 2021, and it is now 6 months on testosterone.
Today is June 2nd, and this is 7 months on testosterone.
Today is July 2nd, 2021, and this is my voice 8 months on testosterone.
Today is August 2nd, 2021, and this is my voice 9 months on testosterone.
Today is September 2nd, 2021, and this is my voice 10 months on testosterone.
Today is October 2nd, 2021, and this is my voice 11 months on testosterone.
Today is November 2nd, 2021, and this is my voice 1 year on testosterone.
And then are sexually active and, you know, experiencing unplanned pregnancy. And now we're going to have to deal with what that's going to mean. Okay? You know, we know that women with PCOS have difficulty conceiving because of how androgens and, you know, from having multiple follicles, you know, because they're producing too much androgens and it's impeding the development of female, you know, the gonadotropic production of female hormones. We know that impacts women's ability to conceive. So if we can largely see these impacts, imagine the smaller cascading effects that are occurring that aren't immediately obvious, okay? Or that you know, or go down a whole cascade of effect that it's hard to just realize that it's rooted, that it's all still based in this one intervention of taking exogenous hormones and then getting pregnant and having all this free-flowing androgens in your system.
I am brave, I am bruised, I am who I'm meant to be. This is me. Look out, 'cause here I come. And I'm marching on to the beat I drum. I'm not scared to be seen. I make no apology.
We're just fucking with stuff that is not supposed to be fucked with. And we're going to pay dearly. And the children, the babies are going to pay dearly. And we haven't yet to be seen what happens. Oh, it's safe. I'm reading all this this shit from these fucking trans OB/GYN pages or whatever, or to advise trans men, trans identified females on the risks of testosterone in pregnancy. It's like, oh no, it's safe, we think. Oh, but just make sure that you've stopped for a while before you get pregnant. Totally ignoring the fact that some 50-60% of all pregnancies are unplanned. And I suspect that is actually much higher. But, even if it is 50%, that's insane. That's a lot. So no, people are not, engaging. And one of our biggest things was, we didn't have a lot of time to engage in preconception planning. And it was always a blessing when we could help prepare a woman to prepare her health to get pregnant so that we're not scrambling. So let's see. Insulin. Let's see. So let's take a look at some of these statistics. Again, this is from the Journal of Medical Sciences, Generational Health Impact of PCOS on Women and Their Children. So there is, after regression analysis to determine the predictive markers for adverse outcomes, the authors determined the pre-pregnancy free androgen index was associated with subsequent preeclampsia, odds ratio 1:1, 95% confidence intervals, and serum fasting glucose and testosterone predicted preterm delivery. Furthermore, they found that a higher fasting serum insulin and serum testosterone, meaning after fasting, for presumably 12 or 24 hours is usually the intervals, if they found that women still have higher levels of testosterone, androgens in their system, it was predicted of any adverse pregnancy outcome. Therefore, this study suggests that women with PCOS and hyperandrogenism have a significantly greater obstetric risk than their peers with PCOS without hyperandrogenism, providing an insight into the potential cause of the increased obstetric risk and potential screening tool. Same group also performed another study with the same women who underwent PCOS phenotypic assessment and also demonstrated a correlation of the degree of hyperandrogenism and gestational diabetes. So they're finding that it is the presence of androgens that is causing a lot of the obstetric morbidities that we're seeing with women with PCOS who are getting pregnant and trying to deliver babies. It is the presence of androgens in the system, in women's system, free-floating testosterone, that is causing these issues. So to say, it would be insane to think that this does not have severe implications for women who are taking exogenous testosterone to achieve some kind of aesthetic. Some kind of, look that they want to achieve. No, the cost is way too high, okay? Don't they have beards that you like a wig that's like a beard? Can you stick something on? If that's so important to you. So it says, we performed a large study using whole population data within Western Australia of over 2,500 pregnant women with PCOS and compared them to 26,000 pregnant women without a PCOS diagnosis. The data was controlled for the use of IVF, ethnicity, maternal age, multiple gestation, maternal risk smoking, and pre-existing comorbidities. The main findings are that offspring of women with PCOS with hyperandrogenism were twice as likely to be born prematurely, 3 times as likely to die in the perinatal period, and twice as likely to require a postnatal hospitalization. Furthermore, the offspring of women with PCOS were at an increased risk of congenital anomaly 6.3% compared to 4.9%, or 1.2 95% confidence interval. This data was additionally corrected for all obstetric risk factors, including gestational diabetes, large and small for gestational age. So it says when the congenital abnormalities were analyzed for the type of malformation, cardiovascular and urogenital malformations were more common in the offspring of women with PCOS. And looking beyond the neonatal period into childhood and adolescence, maternal PCOS was associated with an increased risk of hospitalizations for their offspring, including for metabolic disorder, disease of the nervous system, and asthma. Oh, Lord. So we know that PCOS has implications for transgenerational health of, from passed down from mothers to their offspring. Okay, and again, that'll just snowball because now then the offspring, are born with congenital problems that can impair their ability to conceive or to, healthily carry a child to term. And it seems, according to this study and several others that I've looked at, that is the free bioavailability of testosterone and androgens in a female system. And I can only imagine, depending on how long you've been on testosterone, at what age you began testosterone, how far away from puberty you've been since you just started testosterone, will impact all of these things. And it's going to impact, a woman's ability to labor. You can't disrupt the ecosystem of the body and expect that there will be no consequences. Another thing that we know is that there is a major difference in male and female, bonding mechanisms with children. We know that fathers don't tend to play a significant or a central or even more important role than the mother until the child is about the age of 6. It's another reason why it's important to keep fathers involved until the age of 6. Just because they're not as important early on doesn't mean they don't become important. That's another discussion. But and we know, and this is partially socialization, but it's also due to brain wiring, and it's part of the, if the mother is carrying the baby, all of these pregnancy hormones and birth hormones are involved in bonding the mother to the baby. It is much more difficult for mothers who have been fully dosed and primed by these birth hormones, women who aren't on drugs when they're through their pregnancy and when they're giving birth and afterwards. Women who aren't on other medications to disrupt those endocrinological, those endocrine functions of the gonadotropes of the hormones of birth. So prolactin, which we know that women whose prolactin is disrupted, maybe because of an influx of cortisol, because maybe she's leaving and having to be in a scary environment, if she doesn't feel safe or comfortable, then we know that this has consequences there's higher incidence of postpartum depression. Babies tend to not adjust as well to the postnatal environment outside of the womb. Another example is it's what cortisol does to the body. So we know that cortisol has a capacity to halt a labor. It happened to me with my first labor. It happens, we see it in nature all the time. If you're ever, walking through the woods and you were to come up upon a doe who is in the middle of birthing a baby, her system will flood with cortisol and it'll shut down her production of oxytocin. And basically the uterus will stop contracting, and actually there's a reflex where the uterus can actually pull the fetus back in and give the deer time to get the hell out of there and find a safe place to keep laboring. Okay, the body is a profound machine that works together in concert. When you interrupt something, you interrupt a lot more than just that one thing. And so even just scaring a deer in labor can halt labor, can cause the fetus to, if they haven't expelled that much, to be, come back into the body and give the mother deer time to get out of there. So it's just interesting to see how much of these trans-identified females still very much are taking on the typical maternal bonding, the single mother role if they are abandoned by their partner or if they don't have a partner.
I will fight for you. I always do until my heart is black and blue. And I will stay.
You made it, Danny.
I get to love you. I get to love you. They say love is a journey. I promise that I'll never leave. And when it's too heavy to carry, remember this moment with me. I get to love you. I get to love you. I get
Your baby deserves you.
Or a strong foundation with the father of their child. It's really interesting how much they don't get to play dad, in the sense that, men have a much easier time walking away and, typically are not as important to babies early on.
I've waited 100 years, and I'd wait 1,000,000 more for you.
And so, like, do these women, are they getting access to the health care that they need? I mean, it is already difficult enough as a new mother to take care of yourself, but then if you have all these additional hurdles of insurance coding and having to make phone calls and explain things.
So I actually went to school for medical coding and billing, so I know a little bit about at least the insurance laws in my state. You're not really supposed to have trouble with something like that because it is illegal to discriminate against anybody based on their sex or gender identity. So if a procedure says it's female only and your gender marker is male, that may cause some confusion, but if somebody actually needs a procedure done, and if you are pregnant, you certainly need prenatal care and, delivery. Everything should be covered by insurance. If it's medically necessary, it can't be denied. At least in my state. I don't know where you're from, but if you do have any trouble, it's definitely worth disputing. Maybe a pain in the butt, but it's better than having to pay all those medical bills. Fertility treatments, though, I don't know. That might be something that would be a lot harder to get covered just because they don't like to cover that anyway. Originally transitioned when I lived in New York City a few years back, and there I did change my gender marker. I changed it on my driver's license, and I changed it through Social Security. Social Security still considers me male. I'm even registered for selective service, but when I moved back to Kentucky, they changed my driver's license back to female because that's what it said in the system from when I got my driver's license at 16. And down here, you're not allowed to change your driver's license without a change on your birth certificate. And you're not allowed to change your birth certificate unless you've had bottom surgery and have letters from doctors and all that crap. So I hated it at first. I was really bummed out. But it ended up working out in my favor because it would have been the same deal as with your husband, where if a code is female only, then they won't cover the procedure. But I had no problem with insurance coverage when I had the baby. It was all covered. I haven't paid one bill.
It's insane. But it's important that we have these sort of codes so that we're not spending money on pointless shit, you know? So let's just stop. Let's just stop. I don't think these women are getting the help that they need. They're not going to.
Do you hear me singing you a song? I can't wait to show you, little baby, how to crawl, how to walk, and how to run.
You made it, Danny.
I get to love you. I get to love you. They say love is a journey. I promise that I'll never leave. And when it's too heavy to carry, remember this moment with me. I get to love you. I get to love you. I get
Your baby deserves you. This woman obviously has some sort of postpartum depression, and from watching more of her videos, maybe even a borderline postpartum psychosis. There's a lot, and it's like, you know, is she getting the support that she needs? She hasn't dealt with her gender dysphoria or whatever's going on. Is she in a space to be taking care of a child, and is testosterone exacerbating postpartum psychosis and postpartum depression? We know that augmenting labor and fucking with these bonding hormones can cause, you know, postpartum mood disorders. Okay, so we could be putting women and children in a lot of harm, and we know that depressive mothers more often have poorly attached infants. It's just so fucking heartbreaking to me, you know? And, you know, are these women going to get the care that they need? Are they being seen? God, it's like, if we can't see the damage, it's like all this instant gratification, and the fact that these medical establishments are enabling this shit and co-signing it, you know, for some quick Band-Aid aesthetic fix for very, you know, deep, more complex problems. Yo, we've got to stand up to this shit. We have to, because this is going to turn into transgenerational trauma and problems, and it's going to cascade. We got to do something.